So we're talking about a concept. So um, this concept is basically a thing that will make you know if a woman will be able to give birth through the vagina, or she will need cesarean section. You understand? So I'm coming. All right. So this is what is a digital pelvimetry. So in digital pelvimetry, I'm just trying to measure, the size of the birth canal as a pelvis. The size of the birth canal, right? I'm trying to measure it what anterior, posterior. I'm trying to measure it in the mid. I'm trying to measure it from what oblique. This is the middle. All right. Anterior, posterior. That's from beginning to front. That's from back to front. Then I'm trying to measure the oblique. Do you understand? So the diameters I get from here, that's the sizes I get from here, will make me know if a woman can be able to give birth, all right, through the birth canal, or we need a cesarean section. So it's just a modern technique. It's used to access what the size and shape of the female pelvis, all right. Especially is important in evaluating whether the woman can be able to do a vaginal delivery. Do you understand? So unlike traditional method, it uses digital imaging techniques, like they do CT scans, they do MRI, digital radiography. So this will help them have a very good view of the pelvis to know if you can be able to deliver the baby, through the pelvis or not. So how is it measured? Digital pelvimetry evaluates what key pelvic parameters. It will evaluate the inlet. How wide is the inlet? That's the transverse and the anterior posterior diameters, like I explained here. All right. Midpelvis, pelvic outlet, obstetric conjugate. Okay. So how does it work? Basically, like I told you guys, CT scans or MRI, it will give them a 3D image. Do you understand? Look at the pelvis in all dimensions. Software calculates distances between bony landmarks. So digital radiography offers lower radiation doses compared to conventional X-rays. So some systems allow real-time measurements and image manipulation for precision. So why do we actually do this digital pelvimetry? There's high accuracy and reproducibility. You can still do it again. All right. So there's low radiation, CT scans, MRI, low radiation. So it's used for in complex or borderline cases. So you want to know if a woman will come and be able to give birth through the vagina, or she will actually need cesarean section, or she will need all those extraction vacuum, or all those forceps delivery. So why digital pelvimetry may help to identify cephalopelvic disproportion. This is when maybe the baby's head will be bigger than the pelvis. Many experts argue that trial of labor should still be offered unless there are clear contradictions, right? So the woman should still try, because sometimes it could just become dilated, to an extent that you actually be in disbelief. So so I think this is just it. But for the contradictions that will make this digital pelvimetry to be important, and for you to just know that a woman shouldn't give birth through the vagina, is if the baby has a breech presentation. Breech presentation is a baby supposed to present with the head. So if the baby is presenting with like maybe the legs, the anus, maybe the side of the body, maybe they have history of difficulties. All right. So also planning for vaginal birth after cesarean. Okay. So this is it for digital pelvimetry.